Very good afternoon, everyone. My topic is intended for the beginners, those who have started but having some difficulties during implant placement, especially BCS, and for those who want to start. So I am going to share about the surgical techniques of placing, drilling of implant, especially BCS, because BCS is our gold standard. So I'm going to describe in a very simplified manner in mandible and maxilla. See, our brain is used to and gets accommodate when we do some action repeatedly. So we get mastery over this technique by maximum or consistent repetition. But as a beginner, we have to start. We have to take first step. So to take that first step, we should be confident that what we are doing and what we want to achieve. So I am going to simplify the technique prescribed by the none other than our Dr. Stephanie Dessers. Now, as a beginner, how to start strategic implantology? See, there are multiple criteria we have to follow. That includes the patient selection, that has to be clinical situation available, and the technical points that we should know and aware that what we are doing. In patient selection, initially we should have courage enough to say no to with high expectation patients. In India, we have conditions like oral submucous fibrosis, that is a restricted mouth opening. In that case, we struggle a lot to engage an implant in distal mandible or distal maxilla. So it's not easy initially. Yeah, after mastery, we can do it, but initially we should not select such patients. Then we have to be extra cautious in patients with parafunctional habit as a beginner. And I urge you don't treat overseas patients who are not there for at least 3 weeks with you. In those cases, if you want to do, you ask patients to stay available for at least 3 weeks for follow-ups, and then you can do. And especially in segments or quadrant, you should be more careful that you should ask to come regular follow-ups, because segments, as a beginner, it's difficult to manage. So in segments, we should be extra careful. And initially, we should leave the mindset of that conventional implantology that we should search for patients who have the high bone quality or higher amount of bone quantity. Here, the scenario is different. In strategic implantology, as a beginner, look for the patients who have the less amount of bone, where there is no cancellous bone or alveolar bone is present. So you can directly land up into the cortical bone, and you can have initial anchorage easily. Then the lengthy or long alveolar or cancellous bone, where you require to place a longer BCS implants, which sometimes, because of not practice and not used to with the tactile sensation, it goes on wobbling inside the osteotomy, and we can leave the osteotomy and engage somewhere else, which can create trouble for us later on. See, we are osteo fixating first. So anyway, try to look for the patients with the less bone quantity, where you can easily drill and perforate and engage with the shorter length of BCS implant. So we should be careful by selecting patient also. In radiological, we should always look for the, see, we are not going for CBCT. We always look for the OPGs, and in OPG, what we are looking is white lines. Whenever you have OPG, try to see and search the white line present inside in the OPG. That can be the nasal floor, sinus floor here, or the junction of pterygoid on maxilla. You can also have the white lines of the internal or the external oblique ridge. These are the highly mineralized cortical bone. You should look for that, and these are the target area for us to engage with the BCS